would also encourage you to please introduce yourself at the chat box for the participants. Please introduce your name or yourself at the chat box, your name and your organization. But if you do have any questions as we go along, please use the Q&A session. And when we get to that point, we'll be able to answer your questions, and the panelists and speakers will be able to answer your questions as need be. So we would just go straight to the agenda of the day. Please feel you would see the attendance link very shortly in the chat box. Kindly click on it and also, put in your details for the attendance. I'm going to very quickly call on the representative of the Director General of West Africa Health Organization to please give the opening remarks, and we would be opening and for him to open the webinar. So I'm going to hand that over to the Director of Healthcare Services at WAHO, Dr. Virgil Lukoso.
Thank you so much, Oloma. Good morning, colleagues, esteemed partners, honorable representative of member states, ladies and gentlemen. It's my pleasure to welcome you on behalf of Dr. Melchior Atanas IC, Director General of WAHO, to this important webinar on From Roadmap to Reality, operationalizing West Africa's first end-to-end vaccine access roadmap. Let me start by extending warm greetings to you on behalf of West African health organizations. As you know, Lassa fever remains one of the most persistent epidemic threats in our regions. For decades, our countries have carried the burden of recurrent outbreaks, impacting families, straining health systems, and affecting national economies. Today, we stand at a pivotal moment. After years of research and global collaboration, promising Lassa fever vaccine candidates are advancing through clinical developments. For the first time, we can realistically speak not only about response, but also about prevention. Let us be clear. A vaccine alone does not guarantee protections. Availability does not automatically mean access. And scientific progress does not translate into public health impact without deliberate preparations. It is in recognition of this reality that WAHO, in partnership with CEPI, the Coalition of Epidemic Preparedness and Innovations, developed the regional Lassa end-to-end access roadmap. This roadmap is more than a technical document. It's a political and strategic commitment. It's helped us to reflect about different aspects on these public health interventions. We question our regulatory systems, our financing mechanism, our coordination mechanism in place. The roadmap also outline priorities, but today's discussions is about its implementations. Moving from plan to practice requires political leadership, budgetary prioritizations, legislative alignment, clear institutional accountabilities, and sustained coordination across sectors and government. It also requires honesty about financing gaps, operational bottlenecks, and the risk of fragmentations if we do not act in concert. We are privileged to hear perspective today about national public health leadership, financing partners, civil society organizations, and we believe that the multi-level dialogue will reflect our beliefs that vaccine readiness is not the responsibility of one institution. It's a shared regional endeavor. WAHO stands ready to facilitate alignment across member states, support coordination planning, strengthen regulatory harmonizations, advocate for sustainable financing, and ensure that equity remains central to every stage of the vaccine access planning. decision we make now, the decision we make now before a vaccine is licensed will determine whether we are prepared when that moment arrived. We remain fully committed to supporting ECOWAS member states in translating the roadmap into operational reality, but success will depend on sustained political will. On behalf of WAHO DG, I thank you all for your participation. I wish us a fruitful deliberation during this webinar, and I'll stand a bit with you to listen to the fruitful discussion to come. Thank you so much.
Thank you very much for that very important speech and for opening the webinar. We appreciate that. So we'll go straight to just reiterate some of the things that Dr. Virgil has highlighted, and that would be the objectives of the webinar. We're going to highlight what the plan, the end-to-end plan prioritizes, and the sequencing of it. We're going to have discussions that explore the financing, coordination, accountability mechanisms, so realities in different levels of governance, regional, national, and subnational. And of course, we are going to be highlighting and preferring, highlighting what the next steps would be, and having discussions, dialogue that would help to align what the expectations of the plan are, the plan is, and responsibilities that the different stakeholders across the different levels have. Now, without so much ado, we're going to proceed now to the next segment of the webinar, and that would be a scene setting presentation of the end-to-end access. Right. So now I'm going to be inviting Dr. Aishat Usman. She's the public health expert at the Lassa Fever Coalition Project in Wahoo, and she'll be doing that alongside with Shivani Sarf. I'm very sorry if I did not pronounce that correctly. She's the Senior Access Manager at CEPI. CEPI is the Coalition for Epidemic Preparedness and Innovation. So I'm going to hand over to you, Dr. Aishat, for the presentation. Over.
Thank you so much, Uloma, and good morning, everyone. So I'm going to be taking this presentation with other colleague, Savani Sharaf. And this presentation is just meant to set the tone for some of the discussions that we'll be having today. So we're talking about the end-to-end access roadmap for Lassa fever vaccine readiness in West Africa, and this is the first. So what does this roadmap really ask from countries and partners to do first? Meaning this presentation is meant to clarify the immediate non-negotiable steps from countries and partners on the implementation of the end-to-end access plan. Next slide, please. Okay, just to give context to the situation of Lassa fever, we know that in West African region, we've recorded outbreaks, and this has exposed our systems, systemic gaps in preparedness, surveillance, and response capacity. While we have the vaccine candidates advancing through the clinical developments, if you have limited early planning for access, financing, regulation, and delivery, it could significantly delay the real-world impact the Lassa vaccine should have. And also, we have disconnected national strategies and unaligned partner investments, which risk the duplication, inefficiency, and uneven access across countries. And this is what led to the development of this end-to-end access with efforts from WAHO, CEPI, and also the Lassa coalition. Next slide, please. So what is the scope of the end-to-end access roadmap? This roadmap isn't just about science, it's a full continuum from research and development, regulatory approval, manufacturing to financing, procurement, deployment, and post-introduction monitoring, all with the goal to ensure we have a sustained, equitable access to the vaccine. It also prioritizes high-risk and vulnerable populations while promoting harmonized regulatory policy and financing approaches across West Africa. This roadmap also defines practical sequenced actions and clear roles for governments, regional bodies, donors, and partners to ensure scientific progress translates into timely, equitable protection. Next slide. Next slide, please. So what are the key objectives of this plan? The Lassa end-to-end access roadmap outlines a coordinated pathway to ensure equitable access to licensed Lassa fever vaccine, outlining what is needed and who does what to ultimately reduce the burden of Lassa. Specifically, these objectives have been broken down into short-term, medium-term, and long-term. For short-term objective is to identify critical equitable access needs and increase transparency among stakeholders. The medium-term objective serves as a call to action for governments, industry, financing institutions, and donors to invest in the critical needs for the next 2 to 3 years, while the long-term objective is to facilitate smooth transitions between partners in global health ecosystem to reduce access gaps and support the country-level introduction of the Lassa vaccine. I would like to hand over to my colleague to continue with the rest of the presentation. Shall I hand over to you?
Thank you so much, Dr. Arshad, and really happy to be here. Thank you to Vaho for organizing this very helpful and interesting webinar. So if we move on to the next slide, please. I have just a few slides to outline some of the interventions that have been highlighted in the roadmap and some of the key priorities, both in the immediate term and then the long term. And maybe we can put a link in the chat for the full roadmap, because this definitely does not cover everything that has been identified and aligned across different partners in terms of the access objectives. But just as a high-level overview, what we really need in the next few years in terms of ensuring access to Lassa fever vaccines is identifying funding for late-stage development. And efforts are ongoing on behalf of VAHO, CEPI, IAVI to understand how this funding can be generated and the investment case. There are also efforts ongoing for alternative pathways to licensure if feasible, but all of that is really critical to understand how a licensed vaccine can be available, because in the end, we know that you cannot have access without a product. So that's really the main goal. In the meantime, we know that investigational doses can be used for clinical trials during outbreaks, and understanding the needs around that, the context around that, how such investigation doses could be used in Lassa endemic countries, and what are some of the regulatory pathways for that needs to be understood better. And again, that's a clear priority for the next year. In terms of moving from vaccine development towards manufacturing and evidence generation, there's a work ongoing on vaccine demand focus to really understand Sorry, next slide. Yes. Just to kind of wrap up the immediate priorities. So there's a need to understand the vaccine demand forecast and understand how many vaccine doses would be needed, as this can really inform the manufacturing investments that are needed and the supply and commercialization planning, as well as really take into account the country level and regional level inputs to make sure that the right use cases and assumptions are being clarified upfront at this early development stage. Fourth, we know that more evidence needs to be generated to enable financing and policy decisions. For example, whether it's epidemiological data, whether it's cost effectiveness evidence, or implementation evidence, all of this can really help support policy and financing decisions. There needs to be number 5, efforts to finalize manufacturing and commercialization strategy, really focusing on the regional development aspect. And some efforts are ongoing, and more progress will be needed in the next few years. And then lastly, but not the least, I really wanted to highlight the intervention number 6 on risk communication and community engagement, as well as social behavioral change, because this came up a lot as a feedback during the roadmap development and was highlighted as one of the most critical pieces that countries can do in the next few years, because this has the ability to inform and influence all of these different interventions, as this can really help understand whether the vaccines in development are acceptable, whether the regulatory decisions can be well understood and can have trust among community stakeholders, whether the demand forecast that has been identified has the ability to be materialized based on, again, community acceptance and trust. And so all this piece is really important, I think, in terms of the key priorities for ensuring equitable access to Lassa fever vaccines for the next few years. And the next slide, please. Just a quick overview on some of the medium to long-term priorities on policy, financing, and deployment. So again, all of these are very important, but pending upon the progress that we have with vaccine development. But once we know that a vaccine has a pathway towards licensure, it needs to be added to the priority list for SAGE, right tag, NITAGs, and more evidence, as I mentioned, needs to be generated to support those decision making. We know that financing is needed for procurement of Lassa fever vaccines, and as early purchasing signals as we can have are most important to enable those financing. And then last but not the least, in terms of really important interventions on deployment, like having an allocation mechanism, like having a regional readiness dashboard, like having early detection and surveillance capabilities. It doesn't, these are really critical interventions that again need to be prioritized as soon as possible. So just next slide, please. Just to give you a very quick snapshot, and this is just for illustration in terms of how all of these activities come together in the roadmap. And again, we will share the link so that you can kind of review this on a large scale. But the idea is we have identified these interventions, and we've tried to identify how much of it is funded and how much of it is unfunded, and how can that be layered and stacked and sequenced so that there are no gaps or delays in the end-to-end access pathway, and to make sure that Lassa fever vaccines are accessible for West Africa. So with that, I'll conclude this presentation, and thank you so much.
Thank you very much, Shabani and Dr. Aisha, for that very very succinct but also comprehensive presentation that tells us what, in a nutshell, what the end-to-end plan covers. And of course, what the road plan actually wants the countries to do, and what the partners to do. This presentation would set the pace and the scene for the rest of the conversations we'll be having during this webinar. So I'm now going to hand over to the moderator for the panel, Aderonke Popola. Right now, she's going to moderate the panel. She's a senior manager at the Blue Public Health, also supporting as part of the coalition support partners. So now I'm going to be handing over to her to call up the panelists and begin the panel.
Thank you. Welcome everyone to this session. So this session will take us deeper into what it takes from the roadmap to reality, especially across national leadership, the sub-national implementation, financing, and community level accountability. So joining me for this discussion, Dr. Bandi. So Dr. Bandi is from Sierra Leone and is the Deputy Executive Director for the National Public Health Agency. So we will be discussing from the National Preparedness lens. Dr. Bandi, please can you accept the invitation for the meeting, and could you kind of mute yourself and turn on your camera? All right. Again, we have Dr. Sorikonde. Dr. Sorikonde is from Benin, Director General of ANSS, and he will bring in the sub-national and operational realities, especially from the endemic context. He will be looking at what readiness really looks like in the field. We also have Shavani, the Senior Access Manager from SETI, who will bring in insights on financing gaps and investment sequencing. Here also is featuring the lead Lassa fever and disease program, the lead for Lassa fever disease program at SETI. He will also be talking from the lens of the Lassa vaccine research and development pipeline and alignment with the access planning. And lastly, we have Ms. Goodness Hadley. She's the Director of Programs at Women Advocate for Vaccine Access, and she'll be bringing in the community trust and equitable perspective. So thank you very much to all our speakers. Now we dive into our panel discussion. So I'll start with you, Catherine. So looking at the presentation that we just had from Shabani and Dr. Aisha, one of the key priorities, which is the immediate priority, is vaccine development. So, and as we all know that the vaccine candidates are currently advancing to clinical development, what critical milestone do you think policymakers should track to synchronize regulatory and delivery preparedness? Over to you, Catherine.
Thank you very much for the question. And before I start answering, I want to thank everybody for attending this important meeting. We have a lot of work ahead, and we are very happy to see the great interest in this, because it will take a lot of support to move forward. And to my question, the question I received, so what are the key milestones policymakers have to think about? I mean, we together under the leadership of WAHO, we were leading an effort to develop a policy research agenda. So to identify, with the support, also with the survey that was publicly made available, to identify research areas that are critical to allow policymakers to make decisions for implementation of vaccines eventually. And there were different areas identified, but I think a key one that I want to mention, I mean, obviously we are there critical one, surveillance of the disease. But there are great country organizations in each country that take a lot of ownership and collect a lot of data. But the key point are communities. So we need to ensure, and with the, of course, the leadership from the countries, it needs to be ensured that the communities who are affected by Lassa fever, who are then critical to the development of the vaccine, to the research, these communities will be key in clinical trials to show that the vaccines work. So it is critical for the countries to ensure that the communities are engaged, that they are willing to participate, and the most important thing, that they trust what is happening. So communication is critical to them. They need to trust the research, but then they need to trust the vaccines. And one key side benefit of this will be that this will hopefully also help them be informed about vaccines in general, about the uptake of vaccines, because I believe that not only Europe, where I live and where I'm from, where vaccine hesitancy became a big problem, also in areas in Africa, there, I'm sure, are the same hesitancy. So this will be a key: community engagement and information. Other pieces are, of course, we're talking about regulatory. Lassa fever, like other viruses in the region, like other diseases, does not respect borders. So it really needs a cross-country collaboration. The Lassa coalition that is spearheaded by WAHO is critical to this. It brings together the Lassa affected countries, the governments of the Lassa affected countries, and it will take a lot of activities to allow for cross-country research, cross-country response to potential outbreaks. And so what would be the key milestone is to synergize regulatory pathways, so agencies that review clinical trials, but then the agencies that will be critical in implementing and approving the vaccines eventually work hand in hand to synchronize, to align their requirements and their pathways and their timelines. This is something that is starting, and this will be a critical piece. And then finally, I think we currently are in the lucky position that there is a lot of leadership from the governments, the ministries of health of the individual countries. They came together to meetings on Lassa fever that WAHO organized, and they showed their support. But we all know that there will be changes in leadership, so will be changes there, and so it will be critical that the individual decision makers currently put something in writing, maybe not laws, but put a clear written statement out there that the countries are supportive and in need of such a vaccine. This will continue help raise funds and will continue help to drive the research. Thank you.
Thank you, Catherine. So for highlighting the need for community engagement. So country collaboration and all. So I'll come back to you, Catherine, but I want to, now that you've mentioned community engagement, I want to bring in goodness to help us look at it from that perspective. So goodness, from the civil society perspective, what does equitable access really looks like? Yeah. Over to you, Goodness.
All right, thank you very much, Aderonke, and thank you for having me on here. Good to meet everyone. From a CSO perspective, equitable access really would start from the planning. And, we just heard about how important the communities are, how critical they are in a successful implementation. So all the discussion around having that equity-focused planning from the very beginning, right? So we need to have a well-developed National Deployment and Vaccination Plan, what we call NDVP, and it must clearly define what prioritization looks like, our delivery modalities, and just the whole strategy, end-to-end implementation strategy that prioritizes, marginalized and high-risk population. Of course, this will be led by the government, which is the National Primary Healthcare Development Agency, in coordination with NCDC, in coordination with NAFDAC and NITAG. So all the discussions that need to happen around equity-focused planning and that granular prioritization of the target population and the high-risk communities will make for equitable access when we finally, have the vaccines for implementation. So I'll just, end this question by saying that equity must be embedded in the plan from the outset. It should not be an afterthought, and it should not be retrofitted right after we have already, decided on our strategy. Over.
All right, thank you. Thank you, goodness. So, yes, that equity must really be, embedded from outside. So, but let's go over to, let's hear from the national level, from Dr. Vangi, let's say his perspective, from the national level. Okay, so from Dr. Sori Konde. So, Dr. Sori Konde, will be talking to us from, will be giving us the subnational perspective. So from at the subnational level, Dr. Sorry, what does vaccine readiness really looks like in practice? So I'm talking in terms of surveillance.
Alors, merci beaucoup. Je voudrais d'abord remercier sincèrement les organisateurs pour la confiance accordée à la Guinée et à notre agence à travers ma participation à ce panel de haut niveau. Je souhaite apporter une perspective résolument opérationnelle en ce qui concerne la stratégie bout à bout, coordonnée au niveau régional et qui doit devenir une capacité concrète et mesurable au niveau sous-district, notamment dans les zones frontalières endémiques. Ceci étant dit, en ce qui concerne ce que ressemblerait concrètement la stratégie au niveau sous-national, je pense que là, la préparation ne commence pas juste avec la disponibilité du vaccin. Aujourd'hui, ça doit se reposer sur 3 piliers opérationnels essentiels. La première des choses, c'est la vaccination la surveillance plutôt qui doit demeurer active, la logistique qui doit être fonctionnelle et la confiance surtout des communautés.
S'il vous plaît, Dr. Konde, s'il vous plaît, Chef Konde, the translation service does not seem to be working. Just wanting to confirm that
Oui, c'est bon.
Mr. Abdulrazak, no, not c'est bon. Abdulrazak, please, we can't hear the translation service for
C'est bon, je peux avancer?
No, ok, c'est bon. C'est bon, Chef Konde. Avancez.
Ok, merci beaucoup. Donc, je disais que la stratégie bout en bout, c'est-à-dire la préparation au vaccin Lassa, ne commence pas dans le district avec la disponibilité du vaccin. Ça doit se faire avant et sur le plan opérationnel, ça doit reposer normalement sur 3 piliers fondamentaux. Le premier, c'est la surveillance active. Et le deuxième pilier, ça doit être une logistique fonctionnelle. Et enfin, il faudrait quand même que les bénéficiaires, que sont les communautés, qu'il y ait une confiance entre les communautés et nos systèmes. Et tout au moins une confiance renforcée. Pour ce qui concerne la surveillance opérationnelle, nous le faisons, mais les définitions de cas doivent être disponibles au niveau des formations sanitaires. Le triage doit se faire, la notification immédiate de toute suspicion, le prélèvement, donc à travers les kits de prélèvement qui doivent être disponibles, le transport organisé des échantillons et surtout un retour d'information. Parce que là, c'est souvent des problèmes. On envoie les échantillons au laboratoire de référence et le chemin inverse de l'information n'est toujours pas, le bon. Ça n'est pas aussi rapide, aussi efficace qu'il faudrait. Et prenons par exemple l'exemple de chez nous, en 2024, nous avons formé dans toutes les régions, toutes les préfectures, les membres toutes les équipes d'intervention rapide, les centres de traitement des épidémies et les centres des opérations d'urgence des régions et des districts pour la planification et la conduite des exercices de simulation. Et déjà, ensuite, nous avons organisé des exercices de simulation sur table dans la région de Zérékoré, qui est endémique à la fièvre de Lassa, mais également la région de Kankan en tenant compte d'autres priorités. Nous voyons déjà que Gekedou, qui est frontalier avec la Sierra Leone et le Libéria, a détecté en cette année un cas de Lassa qui a été géré, et également une autre préfecture non frontalière qui est à Farana, dans la région de Farana également, il y a un cas de Lassa qui a été détecté. Donc, ça permet de faire en sorte que le système soit beaucoup plus réactif en matière de surveillance. Donc, la détection précoce et la notification à temps. Ça permettra de mettre en place les mesures de réponse. De l'autre côté, le pilier 2 qui concerne la logistique qui doit être anticipée en fait. On n'attend pas que l'on soit fin prêt pour pouvoir parler de la logistique. Donc, cela va reposer sur l'évaluation réelle de la chaîne de froid existante au niveau des districts, donc au niveau sous-national, une maintenance qui doit être planifiée pour tous les équipements, la disponibilité également de l'essentiel qu'il faut pour le transport, peut-être le carburant, les engins roulants, également de ce côté logistique, comme chez nous, par exemple, nous avons la pharmacie centrale de Guinée. Il y a le programme élargi de vaccination qui s'occupe de tout ce qui est vaccination de routine. Donc, à ce niveau, un besoin de coordination est là avec toutes les autorités locales, surtout. Et à ce niveau, le principal goulot d'étranglement pourrait être la fragmentation de la coordination nationale. Chez nous, il y a beaucoup d'efforts qui sont fournis, mais on n'est jamais sûr à 100% que tout ce qui est mis en place comme dispositif fonctionnerait correctement quand on sera dans des situations réelles. C'est pourquoi on fait des exercices de simulation pour voir comment ça peut fonctionner et quand on sera dans des situations réelles. Également, les besoins des districts en paquet minimum, ça doit être garanti. Il faudrait que les entités opérationnelles de nos services de santé, de nos dispositifs de surveillance et de réponse aient le minimum qu'il faut pour pouvoir être réactifs. Les ressources pour ne serait-ce que l'entretien des engins roulants ou le déploiement des équipes d'intervention rapide, le carburant qu'il le faut, également une autorisation opérationnelle claire. Donc voilà, en principe, donc aujourd'hui, on se rend compte que la communauté, les services opérationnels sont beaucoup plus réactifs, beaucoup plus intéressés, beaucoup plus dynamiques lorsque les alertes qu'ils détectent sont suivies d'action. Quand un centre de santé, une communauté détecte à travers les signaux, comment dirais-je, une situation qui aboutit à une épidémie et que des réactions soient organisées, la riposte soit organisée après, ça permet d'avoir non seulement l'adhésion formelle de toutes ces communautés, mais également l'encouragement de ces agents à la base, qui peuvent être les agents communautaires, les agents de santé communautaire, les relais, mais également les communautés qui se sentent protégées, qui se sentent prises en compte dans ce que nous faisons pour la protection de leur santé. Donc voilà, en résumé, ce que je voudrais apporter par rapport à cette première question. Je vous remercie.
Thank you, Dr. Conde. So you talked about the service delivery system. You talk about the planning and the drills. You talk about logistics, and you also mentioned clear authorization processes. So can you please emphasize more on what readiness really looks like in terms of community engagement? Hello, Dr. Conde.
Oui, je suis là, je n'ai pas compris.
So I said, in your discussion, you had mentioned what readiness is like in terms of logistics, in terms of clear authorization pathway. We talked about operational
Oh oui.
services. So I just want you to expatiate more on what the readiness looks like in terms of community engagement.
Oui.
Can you hear me, Dr. Kambi?
Oui, je parlais de l'engagement communautaire parce que, comme on le dit, les épidémies naissent dans la communauté et c'est là que les épidémies sont clôturées. Donc, la sensibilisation des communautés concernées pour qu'elles comprennent de quoi il s'agit. Tout ce que nous mettons en place, ces communautés doivent être partie prenante. On n'envoie pas juste des équipes, soit du niveau district, du niveau régional ou du niveau central pour venir faire des actions équitées, mais il faudrait que ces communautés, à travers leurs représentants, soient impliquées à toutes les étapes de ces activités que nous faisons. Ça leur permet de comprendre et de faire une sorte d'appropriation et ça nous permet d'avoir également leur adhésion. Vous comprendrez si on ne parle pas avec ces communautés que, par exemple, un cas suspect de Lassa soit détecté, quand l'équipe viendra pour l'investigation, ça sera tout un problème. Et surtout quand on doit venir administrer des vaccins, ça sera encore pire. Nous avons connu ça dans notre pays. Donc, d'où aujourd'hui la mise en place des plateformes Une seule santé dans toutes les préfectures, les sous-préfectures dans la région forestière, dans lesquelles les communautés sont valablement représentées. Et ce sont ces pratiques qui peuvent nous permettre quand même de faire en sorte que il y a moins de problèmes quand on viendra pour des mesures réelles d'investigation, de réponse. Et parmi cette réponse, ça peut être la réponse vaccinale, tout comme nous pouvons faire également des activités de vaccination préventive, comme nous sommes en train de le dire. Mais il est nécessaire que les communautés soient considérées partie prenante, qu'elles soient impliquées dans toutes ces activités préparatoires, qu'elles comprennent à travers leurs représentants, les leaders des jeunes, les leaders des femmes, il y a les leaders religieux qui sont très, très compréhensifs, donc, qui pourront aider à ce que toute la communauté adhère à ces interventions. Merci.
Thank you, Dr. Conde, for that insightful feedback. We need to carry everybody along at the different phases so that we all from our local group. So we quickly go in back to Catherine. So still talking about the one of the priorities, immediate priorities, which is for the vaccine development. So Catherine, I want to ask how countries can engage proactively during clinical development phase, so that to ensure that the trial data, the pathways, and post-licensing production are aligned with the national system.
Yeah, thank you. And I think this is a critical point, of course. What can the countries do? And really not so much to add of what I've said before, really help, with the communication with the political leadership there. But specifically for clinical trials, we have the very good example of several countries that are affected by Lassa fever that include Nigeria, Liberia, and Sierra Leone that built in-country task forces focusing on Lassa vaccine development. And these instruments, so these groups, they meet on a quarterly basis in most cases, and there's a regular update on progress in research. And what this does is, so these task forces include stakeholders, researchers, CMDs from the clinical trial sites, but most importantly, also regulatory agencies and ethics boards. And so there is a regular flow of information, regular update. And so this will help and does help, as we see now, to facilitate the submissions of clinical trials and all of this. So in the past, there was clinical trial submissions took several months. It was unpredictable how quickly, and this is fine. I think it is also important to take the time to review this. But for diseases that are so important for the region, it is important to synchronize across the the countries and to find a process that is more efficient. And this is happening now. And I think this is really comes from country leadership and country support. One other area we haven't, I mean, we heard about logistics and communities and other pieces. I think one important piece is Lassa fever is an endemic disease. It's prevalent throughout West Africa, but in some areas like the south of Nigeria, it's really a seasonal disease. But what can happen and what does happen frequently is that Lassa fever occurs in regions that have not seen Lassa fever or where it was not diagnosed so far. Or the areas, or there might be a season that has a much stronger support. So what the country, a much stronger season. So what the countries should be doing is help prepare for such incidents, and then what could be developed, and this is something that needs to be discussed, is would the countries be open, would the communities be open to accept investigational vaccines that are not licensed yet during these emergencies, to allow for intervention, not public health intervention. That's not possible and shouldn't be done ethically, but it could help to protect certain at-risk groups like healthcare workers, and it could help, if this works out, it could help to accelerate the licensure of such vaccines. So this is really critical, but this can only happen if the countries want this, if the communities want this, and if the regulatory agencies accept this. And I think this is a key thing that should pick up in all of these task forces, in all of these discussions. Can this work? The vaccine developers have to think about when would they have doses available, when do we have sufficient safety data that we can ensure the vaccine does not cause any side effects that are unwanted. And so when are we ready for this? And this is a critical, need from the countries to discuss this. Thank you. Over.
All right, thank you, Catherine, for highlighting the importance of countries buying into the use of investigational dose during outbreak settings, and that will also, assist the development of the vaccine. So thank you for highlighting that. So, Catherine, I'll still come back to you, but I want to bring in Dr. Vandy to speak to us from the national perspective. Dr. Vandy?
Yes, please.
So I want, we know that Sierra Leone has faced repeated outbreaks, looking at the Ebola outbreak and even the Lassa fever outbreak. And so looking at that experience, learn from that experience, what practical steps should align to help align the national budget, regulation, and institutions so that vaccine readiness does not stall at the national level.
Yeah, okay, thank you. Thank you very much. Sorry for me joining on and off because I think initially I joined as a participant, not as a panelist, so I've been struggling with it. But thank God the IT guys have sorted it out. Thank you very much. I think this is very crucial. At national level, vaccine readiness must be sequenced as governance first. Surveillance triggered, finance second, regulatory preparation in parallel, delivery system strengthened before arrival, and the risk communication activated early with continuous feedback across all pillars. So in short, it's like sequence starts with coordination and not commodities. That is how coordination, not commodities. So activate or strengthen the National Vaccine Readiness Steering Group embedded within the National Public Health Agency, and because the task force that we spoke about yesterday or Monday or Tuesday, rather, the first day. So to ensure presentation from you have to ensure the task force has representation from surveillance, from emergency preparedness unit, from the EPI that is actually implementing the actual vaccination activity. Of regulatory bodies, the pharmacy board have been very much inclusive procurement, finance, and risk communication, which is very critical. How do you prepare the community, the recipient, prepare the ground before you introduce the product? And of course, the local authorities, you have to work with them to ensure you have that access, to the community for you to be able to have the community ownership. And the security sector, we are relevant because when you are introducing a vaccine in this country, we have seen, even though it is very, these vaccines are harmless, but some people, because of one or two reasons, whether political or whatever, mischievous, they want to throw spanner into the works. So you may require security, to ensure that things move on smoothly. So basically that is that. And then without governance alignment, financing, regulatory clearance, and delivery system move in silos, and readiness stores. Readiness stores. So therefore, the governance alignment is critical. Otherwise, there will be people moving with their silo mentality. The readiness triggers from surveillance data. You use surveillance data as the activation engine, because that's the data that you're using for that. For predefined epidemiological threshold that trigger readiness action. Confirm the regional outbreaks, important risk, and sustain cross-border alerts. So all of this is. So all of these are I'm getting some feedback. Hello.
Yeah, I can.
So link
Hello, Dr.
triggers.
Vandy.
Yes.
Okay, so thank you very much. So I picked one key statement from you. You said readiness starts with coordination and not commodities, and at the center of this coordination is governance. That government alignment with other parties. So you had said that if governance is not there, that coordination is not there, that other pathways work and find it. So thank you very much for that insight. So, but again, I want to ask what is the biggest, bottleneck in aligning the regional roadmap with domestic projects and legislative process?
Come again. You are coming in broken. I'm not getting you clear. The line is broken.
Can you hear me now?
Yes. It's better now.
Yeah. So I said, what is the biggest bottleneck in terms of aligning the regional roadmap with domestic budget cycles and legislative processes?
So the biggest bottleneck for that is like the regional urgency for the introduction versus domestic budget rigidity or even availability. So of course we are urgent. We want to implement. We know we need it. If the country need it, the people need it. But then the budgetary aspect, the domestic budgetary aspect of that mobilization is somehow stiff. That could be the biggest bottleneck. If the vaccine is ready now, and then we approach the country and they say, well, because of ABC, we are not able to mobilize resources to do ABC. That could be the biggest bottleneck. So the regulatory panel, the regulatory preparing must be run concurrently with surveillance signals. So this is very, very important. If you are ready now, the vaccine is ready today, and they will say, okay, Australia, you have this quantity of vaccine for you to roll out. But it is required that we also have to generate resources. And then, because of one or two reasons, we know the budgetary allocation to health, and maybe we are going to rally from other partners to come in to support, and they have their own budget policies, and they have their own timelines different. So that also is going to that's going to be the biggest bottleneck in this implementation. So therefore, we need to address those issues before the communities are present.
All right, thank you, Dr. Bandy, for highlighting the bottlenecks and highlighting all the bottlenecks. So I quickly want to bring in Savani, still, talking about the regulatory and manufacturing and readiness. So, Savani, so the roadmap you gave an overview earlier on and highlighted critical enablers to regulatory and manufacturing readiness. However, financing gaps, is always there, especially between early stage research and development and last mile delivery. So I wanted to talk from Sophie's perspective, which of the components of the roadmap remains unfunded or underfunded, and how do you think countries and partners should think about sequencing financing? Thank you, Giovanni.
Thank you so much for the question, and thank you to the panelists for their very valuable insights so far. So talking about what components of the roadmap are unfunded, as you may have seen, the roadmap has 5 different pillars going from development all the way to implementation. And I think all of those have different levels of funding needs that are critical and important to address right away. And I think from what we're hearing across panelists is that we think typically activities have to be sequenced. So vaccine is available, and then we start about implementation funding. However, I think we have an opportunity to leverage the political will on Lassa and leverage the demand and need to really start thinking about implementation funding upfront. So some of the regional components that have been highlighted, like early surveillance, community engagement, regulatory readiness, and these are important not just for Lassa, but they can really help ready the region for broader outbreak preparedness, even for other vaccines outside of Lassa. So those are really critical and unfunded. And I think that, we don't know the exact formulations for Lassa vaccines that we are dealing with. But typically, they might have, cold chain requirements. They might have 2 doses. And so, for example, thinking about cold chain infrastructure strengthening, thinking about how to improve coverage after first dose, I think those needs can also start right away, and they are needing some additional infrastructure support in the region. And then thinking about some of the bigger, like, critical development needs, as we've talked about, vaccine development and R&D needs support, as it's not something that CEPI can fund alone. It's a really broader issue and needs a pool of funding across different partners in terms of advancing these candidates towards licensure, and that's something that we're working on. We know that manufacturing and commercial readiness needs funding support as well, and especially to ensure that these vaccines can be manufactured within West Africa. I think that's really important from a regional readiness perspective, and again, setting up the region for not just Lassa but other regional vaccines. And again, these investments need upfront support, and are critical, again, not just for Lassa. And then finally, I mean, we think about vaccine procurement funding a bit later, once the vaccines are available. But typically, if you have a sense of early funding or demand guarantees, or understanding from the region that these vaccines will be funded or procured, then it can sometimes incentivize funding and investments in other parts of the value chain. So if we know that there is funding support for, let's say, Lassa fever vaccines from Gavi or other regional funders or countries in the national budgets, it can be a signal for late-stage funders to invest in clinical trials. It can be a signal for manufacturers to invest in manufacturing scale-up for Lassa fever vaccines. And so I think that there is an opportunity to learn from previous vaccine implementations, where if you sequence everything, then sometimes you end up with delays. And I think there's an opportunity to innovate and think about how can we, bring some of these funding pieces upfront, and think about, accelerating and smoothing that pathway. So thank you.
Okay, Shabani. Highlighting all the different funding gaps from implementation funding up to manufacturing and scale up. So I want
after the webinar,
at this point I want to bring in Dr. Bandi again to elaborate more on this early funding, early investment preparedness. So Dr. Bandi, from Shabani's presentation, from Shabani's point, she had mentioned some underfunded components of the roadmap. We talked about implementation funding, funding for early surveillance, community engagement. So she also mentioned vaccine procurement funding, and I want to ask you this: that we all know that uh, vaccine readiness and compete with other health urgent health priorities. So how can the Ministry of Health, looking at all these funding gaps, make a compelling case for early investment in preparedness before the vaccine is licensed? Hello, Dr. Bandi.
Hello? Hello?
So, do you hear my question?
Are you getting me?
Yes,
Do
I
you
can
hear
hear
me?
you. Yes, I can hear you.
Yes. Please come again.
So I said from Shabani's last discussion, she had mentioned some aspects of the roadmap that are underfunded or not funded at all. So she talked about the need for funding for implementation. She mentioned need for early surveillance, community engagement. She also talked about the cold chain requirements um, and vaccine procurement funding and also manufacturing scale-up. So I just want to ask, we have all these funding gaps or areas that are underfunded. So looking at this and other urgent health priorities, how can the Ministry of Health make a compelling case for early investment in preparedness before the lack of vaccine is licensed?
Yeah. Okay. Thank you. I got it. Now, Tuesday, when we are presenting, we mentioned some of the challenges relating to the surveillance, the gaps in data. We mentioned that most of the cases are coming late since the surveillance we're able to identify the outbreaks and investigate them and know where they are coming from. We're able to target that. So there's a gap with surveillance, of course, we know because the cases are coming late. I mentioned that the case fatality for Lassa fever in Sierra Leone is higher than the sub-region, meaning we have a gap in surveillance, in the surveillance of Lassa fever cases. It is documented that between 15 to 20% across the sub-region. But here is more than that because they come late, we pick them late because either the health seeker behavior or the healthcare providers are not thinking of Lassa fever immediately when they see a febrile case. They try to manage it first with malaria, try one type malaria medication and the other one until it reaches the stage of hemorrhage. That is the time they will pick it up. So those are the areas we are trying to strengthen. With the pandemic fund that we're able to secure, we are trying to close those gaps on surveillance. We are trying to improve on the surveillance system as well as the laboratory. We mentioned yesterday about the sequencing opportunities that we have, that we're able to identify the strain that is circulating within our country. We're able to identify that. But then there is a need to improve the public health laboratory network to ensure that we're able to get our diagnostics on their feet, to able to strictly be able to identify that and also maybe to sequence to identify the circulating strain that we have in the sub-region. Equally, the case management data also could be used so that we're able to prioritize the target groups that we'll be using to administer the vaccine to. So those ones are all these are all the priority activities the public health agency with or without the vaccine introduction, those are the areas that we think we need to strengthen for us to be able to prepare, be ready enough for any, whether vaccine or for even putting our early warning system in place so that we're able, because here we are in an endemic zone, not only for Lassa fever now, but it's not a matter of if we have an outbreak. It is a matter of when the outbreak will occur. So these are part of our readiness strategy that we have put in our activities. So any funding opportunity that we have, we want to close those gaps so that before even the vaccine is ready, or not only for the vaccine, for the next outbreak, because we are used to we have been used to fighting outbreaks. After Marburg, after COVID, we have currently just concluded Mpox that was successfully done. We have Ukraine also. We are responding in the country, although that was within just few districts. So basically, those are the areas that we need to strengthen to ensure that when the introduction of the vaccine, we want to move on swiftly with the implementation of the vaccine to those that actually need them. Over.
All right, thank you, Dr. Bandi. So we're running out of time. So I quickly want to bring in Dr. Conde again to just in a few minutes tell us about how the local communities, especially in the rural communities and island areas, how actively local health workers and communities involved in preparedness, especially in preparedness and also eventual vaccine rollout. Dr. Conde.
Ah oui, vous me recevez?
Yes,
Vous me
we can
recevez?
hear you.
Ok, merci beaucoup. Et l'implication des communautés locales, je pense qu'on peut inclure ici même les agents locaux, puisque dans notre pyramide sanitaire, le centre de santé est une propriété des communautés. Donc, à partir même des formations sanitaires les plus basiques, leur implication passe par la formation, parce qu'il faudrait qu'ils soient formés, qu'ils soient outillés. Donc, les outils de rapportage et les équipements de travail doivent être rendus disponibles à leur niveau et doivent bénéficier régulièrement de supervision. Mais il y a un aspect souvent qu'on néglige un peu, c'est cette question de motivation. Parfois, on a l'impression que l'on considère comme motivation tout ce qui est argent, alors que les reconnaissances institutionnelles, valoriser les gens lors des réunions pour les résultats qu'ils ont pu produire, c'est aussi également des éléments qui peuvent faciliter, disons, leur implication. Ça peut vraiment être un engagement intensif lorsqu'il y a ces éléments. Donc, la reconnaissance institutionnelle doit également être prise en compte. Par exemple, on s'est rendu compte lors des exercices de simulation qu'on a organisés en zone forestière que lorsque le QSP du district déclenche une riposte visible à la suite d'une alerte qui a été remontée à partir d'une formation sanitaire, la plus petite qu'elle soit, ça donne beaucoup d'engagement, ça intensifie l'engagement de ces acteurs. Mais pour la communauté elle-même, pour plus d'implication de la communauté, je pense que je l'avais abordé, mais je vais insister sur cette intégration des leaders communautaires. Parce qu'il y a des personnes qui sont écoutées dans la communauté. Donc, si ces personnes qui sont écoutées sont impliquées dès la phase préparatoire, donc c'est ce que nous faisons. On les implique dès la phase préparatoire, donc elles deviennent les porte-parole du système de santé vis-à-vis des concitoyens. Donc, l'implication de ces leaders communautaires dès la phase préparatoire, également les messages qui doivent être validés et harmonisés surtout. Nous savons que la première épidémie d'Ebola que notre pays a connue, les premières communications étaient faussées. Quand on a dit aux gens, Ebola c'est une maladie, il n'y a pas de remède, mais venez au centre de traitement. Mais la question, elle est légitime quand les gens disent, mais pourquoi on va venir à partir du moment où vous dites qu'il n'y a pas de traitement? Donc, l'élaboration des messages clés qui sont validés et harmonisés, c'est aussi essentiel. Dans cette zone forestière, par exemple, nous avons élaboré ces messages clés et qui sont traduits dans toutes les langues locales. Et là, c'est là où les radios locales interviennent. Parce qu'à travers ces radios locales, nous faisons passer ces messages clés dans les différentes langues. Nous savons que dans une même préfecture, il peut y avoir plusieurs langues locales. Donc, les principales sont prises en compte et les messages là sont traduits dans ces langues locales, de telle sorte que les radios communautaires qui sont là et qui collaborent avec nous, quand on diffuse, ça permet de toucher un maximum de la population. Et nous savons tous qu'il y a aussi la question de la gestion des rumeurs. Pour avoir une implication de la communauté, il faudra que les rumeurs soient traitées le plus tôt que possible. Donc, la gestion de l'infodémie est très importante. Parce que si nous laissons les rumeurs prendre du temps sans réagir, plus ça prend du temps, plus les gens vont y croire. Et là, ça vient mettre en mal un peu cette implication communautaire. Donc, bref, je vais résumer en disant que la confiance de la communauté, c'est aussi un intrant pour moi. C'est un intrant aussi important que la chaîne de froid. Parce que si on n'a pas la confiance de la communauté, tout ce que nous allons faire, ça ne va pas aboutir au résultat final escompté. Je vous remercie.
Well, thank you, Dr. Conde. So we're really running out of time, and I would like to give participants the opportunity to also contribute to this session. So I want to open up the session for question and for the question and answer. So we have a question here for Dr. Bandi or Dr. Conde or Catherine, and it reads: if we reconvene in 12 months, what concrete evidence would demonstrate that the roadmap has moved from strategy to implementation? And which institution or actors should be held accountable for delivering that progress? So this question is directed to Dr. Bandi, Dr. Conde, and Catherine.
Oui.
So any of you can answer, please.
Merci beaucoup pour la question. Si j'ai bien compris, la preuve concrète que la feuille de route est traduite en action concrète, c'est cela? C'est ça la question?
Yes, and what concrete evidence will demonstrate that the roadmap has moved from strategy to implementation? Did you get that? So the question reads, if we reconvene in 12 months, what concrete evidence would demonstrate that the roadmap has moved from strategy to implementation, and which institutions or actors should be held accountable for delivering that progress?
Oui, je vous remercie. Et au niveau national de la Guinée, je disais tout à l'heure que l'année dernière, nous avons organisé des formations sur la planification et la conduite des exercices de simulation. Et la priorité que le pays avait faite, c'était de commencer ça dans la région forestière, la région de Zérékoré. Ça a été fait là et cette région de Zérékoré est la plus endémique à la maladie. Et également un exercice de simulation avec toutes les parties prenantes en a suivi. Mais nous avons également dans chacune des préfectures à haut risque institué la stratégie de la surveillance sentinelle. Parce que comme je l'ai dit, l'une des premières étapes de la chose, c'est d'abord ces trois piliers. Il faut que la surveillance soit très active, donc renforcée. Il y a la question de la logistique également, mais tout ce qui est communautaire. Donc aujourd'hui, il y a les sites sentinelles de surveillance renforcée. Nous avons même pris au-delà de la fièvre de Lassa, de toutes les fièvres hémorragiques virales. Parce que les deux épidémies d'Ebola que nous avons connues dans le passé sont parties de la région de Zérékoré. Donc nous avons mis en place un système de surveillance sentinelle des fièvres hémorragiques virales dans la région de Zérékoré, et qui ne prend pas seulement le Lassa en compte, mais le Lassa est la priorité parce que ça permet d'avoir beaucoup plus d'informations, d'améliorer la surveillance. Mais comme nous sommes dans l'approche intégrée, on ne va pas faire du verticalisme. Et de l'autre côté, aujourd'hui, nous avons une opportunité qui est le PRECES. le programme de sécurité sanitaire en Afrique de l'Ouest et du Centre. L'une des difficultés que Vanny avait indiqué tout à l'heure, il y a la question de financement. Et de notre côté, moi, je dirais la question de financement discontinu, surtout pour les districts. Donc aujourd'hui, il y a des unités régionales du programme de sécurité sanitaire qu'ils ont mis en place et ça permet d'être beaucoup plus réactif. Au lieu que l'ANSS traite tout ici et envoie au niveau des districts, alors qu'il y a des équipes d'intervention rapide, il y a des centres d'opération d'urgence dans chaque district et région. L'unité régionale du PRECES s'occupe directement de la gestion de ces questions à la base, où les ressources peuvent être rendues disponibles au niveau des équipes d'intervention rapide, des centres d'opération d'urgence lorsque les cas sont détectés pour répondre rapidement. Donc voilà, grosso modo, ce que je voudrais apporter par rapport à cela. Merci.
Hi, thank you. We have another question from the participant, and this question goes to Shivani. The participant wants to know that from a donor perspective, what specific signals of seriousness or readiness from government increases confidence and unlocks sustained financial commitment? How about you, Shivani?
Yeah, thank you. I think that's a great question, right? So I think it's, signals can be at different levels. So one is more, a sense of political commitment, and as I said, like a clear demand signal to say that even though that there are various vaccines in development and in need in West Africa, Lassa is actually among the priority vaccines, and this is really needed from a West African perspective. And I think that's a signal we have already received, and I think that's really incentivizing a lot of different investments in Lassa. I think that in an ideal world, a sort of a demand or purchasing guarantee, would be helpful to think about, national budgets and how, if you have different, funding availability for Lassa fever vaccines in the region. So not fully financing, but maybe from a co-financing perspective or a self-financing perspective, if there's a early demand guarantee, that's a signal for a lot of funders to invest in these vaccines and bring them to not just licensure but also procure. And I think that overall, some of the efforts that are ongoing in terms of regional readiness, having a regional readiness dashboard is something that, we've been discussing, which can really highlight how, ready the region is from everything that we've talked about, from infrastructure perspective, but also from a community engagement perspective and willingness and political will perspective. I think that also has an ability to unlock some sustained financing. So I think it's a combination of all of these different efforts. But I will say that yes, a clear demand signal, and then a sense of a sense that these vaccines will actually be used and be procured in countries. I think that's the main ideal goal. Thank you.
All right, thank you, Shivani. So we have a last question here from Joseph Akwem, and I'll direct this question to Dr. Bandi. The question goes: is there any regional or local support to laboratories engaged for Lassa fever diagnostic?
Hello, can you hear me?
Yes, we can.
Yes, as I mentioned about the diagnostic capacity in country, and also the attempt to have a network of public health labs within the country that are able to do this testing is being improved upon with the pandemic fund that we're able to secure. We are currently working with the World Bank to upgrade the Center of Public Health Laboratory, reference laboratory in country, and to also to establish the regional labs as well. And there's certain way to make, we at times ship our samples, wherein if we are not able to run the type of pathogen that we are looking for, we can send to Senegal, Senegal have been very, very helpful. I think Senegal and Cote d'Ivoire will also send samples to them. So there's that regional collaboration with them if need arises. But we are trying as much as possible to have capacity and capability in country to be able to run most of the testing. Over.
Thank you very much, Dr. Banji. So, rounding off and just to give a few highlights of what we have discussed today, a lot has been said, and just a few summary of key points. So, with the need for financing, has been emphasized. So, and Shivani has mentioned that all combination of all efforts from across all the different pathways and responsible actors is needed to unlock sustained financing for Lassa fever vaccine. Then there's also the need, the Banji mentioned something about the need to strengthen surveillance data, improve public health laboratory network, and case management. That when this is all done, this can translate into making, a compelling investment case for Lassa fever. So we also looked at that we also talked about readiness starting starts with the coordination and not even the commodity itself. That governance is at the center of everything. That there's need to coordinate to coordinate. There's need for proper coordination across all the different pillars of the access roadmap. Then we talked about community engagement, the need to carry community people along from onset. So Goodness mentioned the need to, that the planning for equity should be, focused and it be embedded from the onset. So these are all some of the things we have highlighted today, and a major bottleneck, for these, especially for financing, and has to do with the regional agency and domestic budget and DPT, and there's need to also tackle that. So we've talked about a lot today, and I only want to say thank you to all the speakers, and at this point, I want to hand over to Dr. Video for his closing remarks.
Thank you very much, Aderonke, for that, for moderating this very important panel discussion. It's great to hear some of the things that have come up and and how this will be translated to the country level, the national level, subnational level. So moving on the agenda, very soon, yes, the feedback form is now being projected. Please, we are a learning coalition. We would appreciate your feedback to be able to improve the webinars, the series of webinars going forward. Be good to hear what you think about the webinar today and how we can improve or something that we should continue to do going forward. Also, please make sure to fill the attendance form, and it's also in the chat box. And also to close off, We have Dr. Virgil, unfortunately, has very competing priorities and had to rush into another meeting. So we are already rounding off. Thank you very much for making out the time to join us to have this very important discourse. We are going to let the conversation not stop here. It'd be good to have this continue on different forms of media at the country level, the sub-national level, and to continue to talk about the end-to-end access plan, so that, like somebody asked in the chat box, when we reconvene, if we reconvene in the next 12 months, what would be the tangible outputs we have from the end-to-end access plan? Let's not let it stop here. Let's continue to engage with it online and even in the countries. For the as we go along for the we're going to share the link to this webinar on YouTube, so that you can share with other people that weren't able to join or have competing priorities. Let them be able to dial in or click the link on YouTube, listen to what the discussions have been so far. We can also take excerpt from it and continue to have this conversation on social media. With that, I'll say thank you very much for making out time to join us today. It'll be good to see you next quarter when we meet again. Thank you very much.